the Greater New Bedford Community Health Center, celebrating Pride in the month of June. Good morning,
Hey, good morning and thank you to the Greater New Bedford Community Health Center, celebrating Pride Month, just about coming to an end now.
Yeah, show us your pride all year long. Record your own eye-opener wake-up call. Record it with your smartphone. Upload it to you local using the WCVB News app.
The Greater New Bedford Community Health Center serves about 25% of the population here in New Bedford, and we really want to make sure that we provide the same quality care that anybody gets through a private family doctor, and that we also want to be good community citizens where we're collaborating in the community to promote opportunities for people to have safe and stable housing, nutritious food to eat, access to education, jobs, livable wages. Those are really some of the most important factors that determine somebody's health.
Can I check your belly button?
Go ahead, Larry, check your belly button. Ready, lay down.
Oh,
Where's
beep,
your
beep,
belly
button? Beep, beep, belly button. Yeah.
We look at the patient kind of globally, not just the reason they're there for their medical visit, but what other factors affect their health. Things that are going on in the family, what's going on at school.
Did you have a good day at school today?
No.
No, you didn't have a good day at school. Okay.
Here in pediatrics, we do reach out and read, so we're promoting literacy for kids, which is really important to get them school ready. In general, in the health center, we look at the whole patient, and we do a lot of things that you wouldn't get in a private practice.
Hi, my name is Joandy and I'm one of the interpreters at the Greater New Bedford Community Health Center. Here at the center, we serve 3,000 patients who need translating services. We have 7 interpreters on staff and we speak Spanish, Portuguese, and Cape Verdean.
Você sabe a que horas é o seu apontamento?
Às 2h15.
2h15. Só muito obrigada, Cecil. Pode tomar assento e alguém já lhe chama. Nada, boa tarde.
One of the things that I think are unique about community health centers is not only that they provide medical care, but they reach out into the community and try to bring the community into the health center.
Hi, I'm Viviana. I work at the Women's Health Department at the Health Center. We have a program that's called Maternal Child Health, and we visit moms at home during their pregnancy. So we educate them in labor and infant care. And once we're done, we follow them up to their 6 weeks postpartum, then we refer them back to their primary care.
A mí me gusta que vienen a verme en mi casa porque puedo hacer preguntas muy personales. No es igual que ir en la clínica. Bueno, también es importante ir en la clínica, pero más importante a mí que me vienen a ver en mi casa porque me siento cómoda, porque puedo preguntar más sobre mi bebé, cómo va todo.
I'm very committed to the mission and the vision and the statements of the health center. Not only am I a board member, I am also a user of the services here. And user I am. Dental has been easy. However, twice I've had life-threatening illnesses of which I have been served here at the health center. What our folks need to understand is we're not just a clinic, we are a health center serving the Greater New Bedford population.
My name is Marshall Montgomery, Dr. Montgomery. I'm the dental director at the health center. I've been here since 2009. The dental department has 6 operatories. There's 3 dentists, there's 3 hygienists, everything from exams, cleanings, x-rays, fillings, extractions, dentures. We also offer a sliding fee scale that private practices don't typically offer for our patients that don't happen to have insurance but need some kind of dental work, especially a dental emergency. We have a whole benefits office on site that helps our patients to obtain insurance, including dental insurance. Our staff is very caring and dedicated, multilingual, multicultural, and really we're just here for the community.
I love the families I take care of. I've been here 20 years now, and so I have kids now who are turning into adults that I've taken care of since they were a newborn. The Greater New Bedford Community Health Center really is a patient-centered medical home.
I invite people to come to the health center and take a tour of it, because when you walk through the health center, you can just feel the passion and the compassion of our staff.
Please come in, take a tour, take a look, see what we have to offer you. From dental to eye care, to pediatrics, to well child, to women's health. It's a multifaceted facility. Come see us.
often we get so focused in the crisis and trying to help people that we forget that, again, there are many more people living in recovery than are living with substance use disorders. So it's a message of hope. We can help people, and we can help them find their path to recovery, and particularly if we can remove the stigmas and people can feel comfortable coming forward and getting help. And to that effect, I'd like to recognize that we have a community partner with us more, the Massachusetts Organization for Addiction Recovery, and we have our Southeastern Mass Regional Coordinator. I know you were going to either say a few words or introduce maybe two members of more who would just share 2 minutes with us about their recovery.
Hi, I'm Elizabeth Mooney. I'm the Southeast Metro West Regional Coordinator for MORE, and I just want to say thank you for the invitation and for all of you coming out. I just say community. My goal really is to bring that unity back to our communities, like the support of each other. There's so many different organizations here and so many individuals in recovery and others that support us. And I asked a few individuals to speak today on their recovery and their barriers and their pathway. And I'd like to introduce Ozzy. He's with TSS. And I'll let him
Ozzy, come up front. Yeah.
Good afternoon. My name is Ozzy. I am very overwhelmed. This is emotional for me because not only does this have to do with my life, this has to do with a lot of my people's lives. Whether they're still alive or whether they're dead, I still am overwhelmed by it. I am a man in long-term recovery. I just celebrated 8 years clean and sober. And I want to tell you a little bit about my pathway in recovery. My addiction started with being prescribed Percocets and Vicodins when I was in a motor vehicle accident back in 1984. And it did something to me. It took me out of myself. And not only did I become a victim, but then I became a volunteer, and I continued to chase that. And what happened in my life is I continued to behave in not so good ways, that it got me some legal issues. And I was a part of the probation department for many, many years, and I should have a pension with the probation department. I was on probation for. When I came into recovery, I knew this was my only chance. And I knew that I might not have another chance, so I dove right in. And I jumped into Narcotics Anonymous and Alcoholics Anonymous, and what a beautiful feeling it was having somebody believe in me. You ever feel lonely? Addiction makes us feel lonely. To the point that sometimes we could be in the middle of 1,000 people and still feel lonely. Or sometimes we can walk up to somebody and say, "Hi, how are you?" But inside we're all twisted up, hurting in so much pain, and not knowing what it is. So we got to go and do something to take ourselves away from that pain. And that was addiction. But Narcotics Anonymous and Alcoholics Anonymous taught me a lot about myself, but I was still empty. There was something missing there. I didn't know what it was. And I thought back about how my mother used to always tell me, "God's not lost, you are." And I knew that I needed to strengthen my spirituality. And that's what was missing, was my spirituality, my connection with my higher power that I choose to call God. And what I needed to do was I needed to get more involved with my spirituality. I needed to get more involved with things that helped me with my behaviors. And I'm not saying anything wrong with Narcotics Anonymous and Alcoholics Anonymous. They're all my brothers and sisters. But my pathway needed to go a little bit different, because there's many pathways. Just like in here, we have the state, local, and federal agencies coming together. I needed to find a certain pathway for my life that was going to save my life. And that was God. So I chose to get more into the faith-based community organizations. And they showed me how to become a man. And again, I'm not taking nothing away from Alcoholics Anonymous and Narcotics Anonymous, but they showed me how to become more of a man so I can become available to my children, so I can become available to my community, and most importantly, I can become available to myself. And they taught me how to chase my God like I chased my drug. And he taught me how to be of service to others and know that it's not about me, it's about helping others. And in that process, I don't know how this happened, but I started going to school, and I thought my brain was dead. But my brain was not dead, because God lives in me to show others. And that's how my pathway became stronger and stronger. And until this day, I still serve the community. I serve my God. I serve my people in addiction, because I work in addictions. And not only am I able to work in addictions, I'm able to learn more about myself, about the community, and about my God. So that's part of my pathway, and I encourage you all to get involved with Celebrate Recovery. Listen, recovery is about everything. It could be about apples, it could be about oranges, it could be about anxiety, it could be about depression. Get involved with some recovery. Celebrate Recovery programs, men's group, women's groups, discipleship groups. Discipleship groups is like all of us together, like we're doing right now. This is discipleship. I encourage you all to seek a pathway in recovery, and I guarantee you your life is going to become tremendously joyful. And I want to thank you again for allowing me to be here, and I know there's a couple more colleagues here to talk about their recovery pathways.
About what it would mean to the people that you treat every day if your budget were reduced even by 10%. Be disaster.
These are services that are not reimbursed. Our case managers, our social workers, we are, as providers, can get reimbursed, but we depend on these grants and federal dollars to help us support the community. And it's not a one-time contact. You're gonna hear 2 years, you're gonna hear 3 years, 5 years, and it's the longevity of how to maintain. We still need services for our elderly community. We still need those folks out there knocking on the doors, getting them the services that they need. And it's beyond just giving a prescription, giving a medication. This is about food security. This is about housing. This is about helping families, get them into care with their mental health, etc. So I think that those programs that support the success of the health center as a provider are essential to the care that we give here.
I have a patient that did not have insurance when I saw her the first time, and when I did an exam, she had masses in her abdomen, and I could not order the CT scan until her insurance came through. And she had children, and she didn't want to pay for the CT scan because she had children to feed. And so that is the difference between me being able to help her and not was medical care.
I was actually thinking that wasn't a very hard question, because I practiced long enough. I was practicing in Rhode Island when folks who had no insurance had no access to surgery at all, or mammography at all. And so the difference, as Dr. Weber was saying, between knowing there's a problem and being able to do something about it, and knowing there's a problem and banging your head against the wall to get people something is tremendous.
I think also cutbacks in the Medicaid program would really stop access for many people to a lot of the preventative programs that we have for chronic illness. So now, with the benefit of Medicaid, young people can access those services in a cost-effective way for them. And without that coverage, they would refer back to episodic care, and that would be disastrous.
If I could add on that, that kind of cut to Medicaid would affect every other program that the Commonwealth provides in every other subject area, because when we started a decade ago in Massachusetts, this kind of expansion for healthcare access was based on a notion at the time, regardless of party, that the federal government was a partner. If the federal government was less a partner, then our ability to provide all the other kinds of services people expect is really threatened.
The fight for healthcare is in life and death. And I am grateful to all of you for all that you do every day for our families here in Massachusetts. But I am also grateful that you are in this fight. We all have to be in it. We have got to be willing to fight back on behalf of the families you take care of, on behalf of the seniors you take care of, on behalf of the little children that you take care of, on behalf of the people with chronic illnesses that you take care of. This is a measure of who we are as a people. And right now it's being challenged. And so that means when it's challenged, you just got to step up and get in the fight.
I'm excited to be here because the work of community health centers is absolutely vital to the lives of millions of Americans, and you all deserve recognition and praise for that. From 2001 to 2006, the number of patients served by health centers increased from 10.3 million Americans to 15 million Americans. And that number has continued to grow since then, reaching 25.9 million patients in 2016, a 151% increase from 2001. So in this transition, we're going to look for models and for partners. Wouldn't it be nice if in pursuing these objectives we had a set of partners that had a track record of delivering quality care at a significantly lower cost? Wouldn't it be nice if we had partners who had taken the lead in using electronic health records, achieving almost universal adoption? Wouldn't it be great to learn from providers who excel at coordinating and integrating different levels of care? The good news is that, as you can probably tell, we do have such a set of partners. It's all of you, America's community health centers. We're committed to greater transparency about prices and ensuring to the extent possible that discounts reach the patient rather than being captured by middlemen. One example of transparency and fairness in drug pricing we've already pursued was our reform to how Medicare Part B pays for certain drugs under the 340B drug discount program. The program was intended to offer affordable medicines to providers focused on low-income Americans, but has now expanded far beyond the original set of providers identified. We know 340B is an immensely valuable tool for community health centers, which by definition serve patients in need of these discounts. We're committed to ensuring the benefits of this program flow to its intended recipients, and that means the patients you serve. The fight of addiction and overdose has reached every corner of America, and the challenge is of immense scale. We saw 63,000 drug overdoses in 2016, and we may see as many as 500,000 more over the next decade. This crisis has especially hit under-resourced urban and rural communities where providers of any kind, let alone behavioral health and addiction specialists, can be thin on the ground. So I'd put a similar question to you as I did earlier. Wouldn't it be nice if we had a set of thousands of partners with a long record of providing quality care in both urban and rural communities? And wouldn't it be great to have a set of partners who are leading on efforts to integrate physical and behavioral health care? And yet again, the good news is we have those partners, and it's all of you in this room here today.